Kenya has been experiencing an alarming number of maternal deaths, losing 1 out of 38 mothers during delivery and children dying in tens of thousands before the age of 5 from preventable causes. This made Kenya to be one of the 81 countries PATH rapidly investigated on, and in 2019, PATH rolled out an asset tracker dashboard of 14 key health interventions keen on paving the way towards health equity for mothers and their children, as well as curbing the maternal deaths. In July 2022, PATH, in collaboration with Access to Medicine's platform Meta Kenya, oriented 32 civil society organizations from the Lake Region Economic Bloc, namely Bungoma, Kisumu, Siaya, Homa Bay, Vihiga, and Kakamega County, on the use of the asset tracker. This was done in effort to support them in their advocacy work in improving reproductive health outcomes for women, children, and adolescents in their region. We are recently fortunate to have been able to indulge them concerning their interaction and experiences with the asset tracker, and this is what the CSO advocates had to say.
My interaction with MNCH Asset Tracker was recently when we were being trained and sensitized on how Asset Tracker is used and how advocates can use to drive the issues within their county. I remember after the training we came and tried as a county to see how we can use it, highlighting and linking it to our 3 key priority areas. That is ANC majorly, where we've been using asset tracker to inform decision. When you look at the asset tracker, it highlights the national performance of specific indicators. It doesn't highlight specific county indicators, but then as a county we have a source where we always get our information, so then it is easy for us to link it, to compare it, how county we are performing together with the national government. Then it informs our advocacy work whenever we want to engage decision makers. So then as advocates within Bungoma County, we've been using asset tracker greatly when it comes to generating our evidence to inform decisions during our advocacy engagements. Okay, I'll mention something to do with tracer's drugs. As advocates from Bungoma, our main agenda is to reduce maternal mortality, and that comes directly with the ANC performance, which is in the part of the asset tracker tool. So then we've been using in terms of how tracer that mothers access during their antenatal care visits. So it is one of the major things that whenever we are advocating to the county government, we make sure that they get to understand the importance of making sure they allocate enough funds to work towards making sure they have these resources in place, so that whenever mothers will be going to their clinic, they're able to get these commodities. Because if, for example, as a county, we have mothers initiating their clinics early as how it's supposed to be, but then they go to the facility and I don't get these specific commodities which is essential to them, most of them might tend to back off. But then when you have these drugs available within the facilities, mothers will be able to get these quality healthcare services within the facility. So then it is one of our issue of advocacy that we've been advocating for using the MNCH Asset Tracker tool.
MNCH Tracker has data. You know, in advocacy, data informs decisions. So it's a key point to advocate when you have data at hand. So when we are going to advocate for certain issues, you know, with the decision makers, you also have to present what you have. So with the MNCH tracker, we can be able to directly present that this is the number of facilities that have these commodities, and these commodities are not here. So that decision maker can see that you are factual. That is when we can inform decision. You know, you just don't go there plain and you don't look like you don't know what you're doing or what you want. So yeah, the data fact part, it's factual, and I believe that can inform decisions, of which for the time I've been an advocate, decisions have always been influenced by data. Yeah, secondly also that we can also compare with other countries, like where we are standing at as Kenya. So we're like, okay, if as Kenya we are at 43, and maybe the best country is at 50, we can know that, okay, we are not really doing bad. Or maybe if we are like low, we cannot like we need to make more interventions, of which if you present such a data to a decision maker, yes, they will see that we have a gap, and that is the reason, or could be one of the reasons, that we have maternal mortality in high numbers in the country.
We've really gained a lot in terms of our advocacy processes as an organization through the trainings that we've got on sensitization, on use of MNCH Tracker. So this tracker, it has really eased our ways because we advocate at both national and county level. But at fingertips and at a click of button, we can be able to get data, relevant data that we can be able to use in our supporting our advocacy work. So because we do evidence-based advocacy. So one of the things that we would like to see change or upscale on this MNCH tracker. So one thing that we want to see is to scale it down to the county so that it can also capture the data of the different counties. We also need it to be to capture at least mapping of different facilities, because we find that people target on different facilities. So we can be able to get data through just clicking, because right now you find that dashboard for RMNCH advocacy, it's getting the data, you have to go through KDHIS. But now these are tools that even the CSOs can be able to access. So one of the things that we want is to see that relevant data on MNCH are availed, the county data, facility data, as well as the national data. So thank you so much.
The assets being talked about in the asset tracker, they are of relevance and then of vital importance to facilities, mostly the ones handling maternal health and stuff like that. We talk of newborn resuscitation, talk of misoprostol, talking of IFRS and every other thing. And then you find that these are commodities that are very, very important for mothers. But then I came to realize that it's not so many people who know about these commodities. And then being that they don't really know about it, does not really inform their ask. Does not really inform for policymakers to make sure that these commodities are availed in these facilities. So as an advocate, it helped me know where to ask questions, where to begin asking questions from whenever I visit a facility, because sometimes we do have sessions with the mothers to be in hospitals. And mothers who are just beginning their prenatal and who are now going on their postnatal. So this asset tracker has actually informed my decision-making procedures and where I need to engage the policymakers. In the asset tracker, there are 3 areas of advocacy and about 2 areas of advocacy. The one that talks about complex intervention, and this one talks about kangaroo mother care. I saw that it's something that it is so natural, and then it's a lot of mothers are taking up this kangaroo mother care. So if it's an area of advocacy, we just need to advocate more on that. That is a complex one. But this new and donor intervention, new and donor independent intervention, that one means that we're really depending on donors for that. So there are commodities that we are still depending on donors for that, and donors are actually phasing out. We need commodities like oxytocin and misoprostol, and most of it we are depending on donors. And then when we talk of data, talking of asset tracker, we really talk a lot about data. But then when I look at the asset tracker, and when I look at one asset, to be precise, the newborn resuscitation, when I try to look at the numbers of health providers that have been trained on this kind of service, you find there is no data on that. But for asset tracker to work, we need very, very good relationship with the data tracking system, or with the data sources, or with the people who are synchronizing, collecting data and synchronizing data. So the asset trackers, the way it was designed, they need to work hand in hand with the data team. Yeah, so that all this data can be found. If I need data on IFRS, if I need data on misoprostol, if I need data on oxytocin, on baby newborn resuscitation, then this can really be a very good thing. So data and asset tracker is something good to go. Yeah.
Yes, my name is Elizabeth Guara. I represent, I'm a team leader of an organization called Manyata Development is Power. We are based in the slums, working in Kisumu, East and Central sub-counties. One of the components, because the asset tracker has 14 assets in it, and one of the things that really caught my eye in the asset tracker is the IFAS, the performance, though the asset tracker really captures on country as a whole. So in Kenya, I realized that our performance on asset tracker was very low. We were around 7-point-something%. So for this confirmation, because I come from Kisumu County, I had an experience of going to my nearest level 2 hospital, and the sub-county hospital, that is Migosi Sub-County Hospital, because my organization supports the young mothers and young women. So I realized that paying a visit to the health facility, because that's a partner health facility for our girls that we refer, I realized that IFAS is actually out of stock in that facility, and it was confirmed by the nurse in charge that they're actually prescribing the IFAS for them to buy at the outlet. So I actually confirmed that the asset tracker, you can really rely on information in the asset tracker, even if it is a view or a point out of the whole country. As an organization, yes, we ensure that we partner with the county health management team. So at any time or at any point this county, the CHMTs have their meetings, then we route on issues of talking about the asset tracker. And I realized that the CHMT are actually aware of the asset tracker that really needs to be devolved down to the sub-county teams and the level 2 and 3 management team at that level. So for the asset tracker, what I realized is that the CHMT are actually aware of the information that is on the asset tracker, but the acceptance of data in the asset tracker becomes a problem with the CHMT, because it's like the information in the asset tracker, they feel like it's not the real the truth about what is presented in our county, because it's a whole presentation of the country. But again, if it's trickled down to Kisumu County, then it brings out the whole thing. But again, it is normal with the county health management team, because they are the managers of the health department. They are like the ones who are owning the information. But once they came up to learn about the asset tracker and really understanding about it, they actually saw that it is speaking of the truth about everything in Kisumu. It's a good tracker to trickle down to our people. And I may say that we keep on assuming that the management team are usually aware of everything, but for your information, some of them are not even aware of it. So that is why we are struggling currently. We had a meeting with the Kisumu County Assembly Health Committee, just to involve them and keep on bringing them on board to ensure that they understand the asset tracker. The asset tracker, as a champion or as an advocate of asset tracker, I feel the asset tracker also needs to be simplified in a way so that as a champion who works directly to the community at the grassroots level, then it will be easy to roll it down by sensitizing the community on it, because it's a whole thing that bringing it down to the community is a bit challenging as an advocate. But again, as an advocate, what I try to do, I will first of all internalize and understand how everything is in the asset tracker. Then I take and trickle it down to the community. So that is what I'm trying to do as an advocate, because I also want to ensure that this thing everyone understands, be it the policy makers, be it the health management team, be it the community health assistant at the ground level, and the CHVs at the end of it all.